Right, so thank you so much for joining us this evening. It's really, really good to be doing this. Obviously, it's a bit of a change. We've been lecturing to students at the start of this week. So I'm with the best will in the world. We've got some fantastic students here, but we don't always get over 100 people coming to lectures. So it's really, really excellent, fantastic to be speaking to so many people on this topic. And we do hope it runs smoothly. It's been a fantastic couple of weeks for the internet, I'm sure you'll know, with Bernie Sanders' mittens. We've got Jackie Weaver in the parish council meeting, and some cats talking to the judge today. So hopefully no blunders like that. But well, in some respects, it might actually that'd be funny if something like that happens. So we'll see. Assuming everything's going to be okay on the technical front, then what I've got in store for you today is about a 45-minute talk on understanding sport and exercise after organ transplantation. So I should say at the start as well, so I've been introduced very kindly as Dr. Gareth Wiltshire, but what we're going to be talking about is actually quite relevant medically, but we need to mention, I'm not sure who is coming to these lectures, but we need to make sure that, to be clear, that it's an academic doctor. It's not the same as a medical doctor. So any issues and discussions and concerns you have around transplantation after exercise after transplantation, then obviously it's important to consult your medical professionals, which is something we say as part of all these lectures. So without further ado, I'll get started and explain what we'll be going through, and I'll try and keep it. It's going to be academic. It's going to be research focused. It's going to be about evidence, but it's also going to be quite light, and it's going to be hopefully plain English and easy to understand for everyone. And it will be recorded as well. So obviously, if people want to share it with anyone else who may find it useful, then please do feel free to share it afterwards. So this general context, then let's just make sure. I'm sure everyone's had kind of busy days at work and doing whatever bring what comes along in the day in these strange times. But let's kind of make sure we're all in the room talking about the same topic. And at the heart of this topic, yes, we're here talking about sport and exercise, but we're also talking about organ transplantation. And as part of this transplantation, we're talking about organ donation. Essentially, at the heart of this whole conversation is the experience of living with someone else's organ inside your body to help improve or perhaps even have saved your life. So that's obviously an incredibly important thing, and we'll talk about in different ways that it's important and how that actually shapes what sport and exercise is after transplantation. This is a topic which obviously is talked about. So I just showed the image there of the recent law change. So hopefully there's a decent amount of awareness and understanding of this conversation in the general public. But the general conversation has also been improved by the music video by Lewis Capaldi's song over the last couple of years, Someone You Love. And in that music video, we see this general story that I'm talking about now, which sets up the context for this talk of what organ donation and organ transplantation is about. And the top left-hand corner, all these stories are, quite, there are differences between the stories, but ultimately a common story is the death of a loved one and the decision to actually pass on that organ to someone else who needs it. So the top right-hand side corner, in this music video, we're introduced to the woman there who is, we're not sure, but she's got a heart condition. And we find out that she has actually been the recipient of the heart. And at the end, we see the daughter of the woman writing a thank you note to the family of the person who decided to donate their organ. So obviously, this is a very, very, even just talking about that, you can see it's an emotional, it's an emotional, social, and kind of medical phenomenon, which we need to take in account of with any topic when we're talking about this issue. So about me then, again with this introduction, so you can contact me through the webpage at Loughborough. I'm a lecturer at Loughborough, and importantly, if you have a look at that webpage, you'll be able to see links to various publications and research I've been involved in. And the thing I'd like to say just as part of this public lecture is that all of those publications are free to access. And so lots of publications, when you go and have a look at them, you'll have to pay in order to view the research papers. But this is about sharing information, sharing knowledge as widely as possible. So we make a point of making sure that there's at least a Word document version of our research papers which are publicly available. So that's the case for me, and you can find them through those links there. But it's also the case for lots of other people and lots of other studies as well. So do go and have a look at them. The other thing I want to mention with me as well is that I have a research interest in this, but my research interest really comes from a personal interest. So my personal story, my personal journey into this topic area is actually through a phone call I had in 2014 when I was driving in the car, and I got a phone call from my wife's colleague, and a phone call saying that she was critically ill and I needed to stop what I'm doing and go and find out how she's getting on. And we found out that she'd had an acute liver failure, and she was in a very serious condition, and her survival depended on a donation of an organ. So we were told that she had, roughly 2 or 3 days to live. And liver is a very serious organ. Unfortunately for her, that became available. So this is a picture of her 3 weeks after that organ transplantation. And this is a picture of her about a year after that. So this is her winning a gold medal at the World Transplant Games. So this is a good opportunity to say that sport and exercise was important in her life, so it really gave me some insight into what is going on here. To introduce this event, the World Transplant Games really does what it says on the tin. It is an Olympic style kind of event dedicated to transplant recipients. And there's usually national level versions of it as well. And so that was a picture from a year after her transplant. And this is a picture a few years after that, where I've wrangled my way into helping out, supporting the team in a coaching capacity. And my version of coaching ends up usually just being clapping and supporting people along as they're really doing well, doing their amazing things. So there is this kind of involvement, and I found it really, really fascinating, really interesting, and I saw firsthand why sport and exercise is a really important thing that we need to do a little bit more about in terms of our research. So this lecture then, what we're going to do is talk through a few main points. The first one is why study it? Why are we bothering studying sport and exercise after transplantation? Hopefully it won't be too much of a hard sell to the audience here. Presumably there's some sort of interest. Secondly, I want to outline the biomedical aspect of what we're talking about, and I frame this in terms of hopes and fears. Okay, so when you're engaging in sport and exercise, what are you hoping for? What are the potential benefits? And then fears, what are the potential concerns? What are the issues that may be potentially negative around sport and exercise? And then after looking at the biomedical things, I want to look at the psychological aspects. I then want to look at the sociological aspect, which is more my area. I'm a social scientist. And then I'll end with talking about the future. How do we make the future even brighter? Okay, so in this way, what I wanted to, the key sort of thing, if there's going to be a message that I want to kind of take away from this talk, is this idea of these three things, biomedical, sociological, and psychological, being things that are studied separately often, but actually they're always overlapping and interconnected. And a really simple way, a simple example to explain that is thinking about a scar. So a scar that all transplant recipients will have, and of different kinds of scarring through the organ transplant surgery, is in many ways around, it's about the tissue, it's about the skin, it's about the healing of the body in a physiological sense. But at the same time, that same scar has a kind of popular culture and social meaning, doesn't it? What does a scar mean in our society? What does it look like? What does it look like in terms of our understanding, in terms of our culture? Scars come up in different ways, sometimes negatively, sometimes positively, but it's a symbol of something a little bit different. It's not just biomedical, is it? And these things can often bring up some psychological concerns and psychological experiences too. So that's one example of how those things are interrelated, and hopefully that will come across through the rest of this talk. So why is it important to understand sport and exercise after transplantation? Why is this an important thing to study? Well, I'll breeze over this because I don't think it's going to be a hugely controversial question for, hopefully, for the people who are attending this lecture. But we need to remember that transplant recipients are a growing population. We can have a look at the Global Observatory on Donation and Transplantation and see there's 146,000 organ transplants in 2018. And we know that the population is growing. Transplantation, of course, is a fantastic medical achievement. We've come a long way since 1954, and the surgery led by Dr. Joseph Murray in Boston, where the patient Richard Herrick received a kidney from his twin brother and went on to live another 8 years after that. So we've come a long way after that. Survival has been increasing in the short term, huge accelerations in people living more than 5 years since the 80s, 90s and 2000s. And there's also an increase in people living long term as well, although that shorter term isn't improving as much as it was initially. But we can add to this achievement. So I think moving beyond survival is really what we're talking about today. So moving beyond survival, and I love this quote from Iwashna in 2010. Long-term health and well-being is a defining medical challenge of the 21st century. And that's because we can now save many people's lives, but we need to broaden our sense of our mission to include understanding, caring for, and improving the lives of those many patients who survive critical illness. So understanding, caring for, and improving the lives who survive. We need to move beyond survival now. So longevity of the transplanted organ is important, but so is living well after a transplant. And for me, living well is about finding meaning. And to offer another quote at the start of this, I'm paraphrasing the Bill Bauman character in the film Without Limits. He says, sport, one might say, is basically an absurd pastime upon which to be exhausting ourselves. But if you can find meaning in sport, the chances are you'll be able to find meaning in another absurd pastime, life. So in this way, doing sport and exercise in people's minds sometimes, you come to a lecture on from the National Centre of Sport and Exercise Medicine, and we immediately think about these biomedical things. But I think finding meaning in things like the transplant games and sport and exercise is a really important part of this whole process of moving beyond survival. So looking at these biomedical hopes and fears, then what am I talking about? And remembering this kind of diagram, keeping this in your minds as we go. So when I'm talking about hopes, I'm talking about probably the positives that we're looking at, and fears being the concerns that we're thinking about, both as recipients, people involved in research, and clinicians as well. So here is a summary of some of the literature that I'm thinking about in both of these domains. So patients who are physically active before their transplant seem to do better afterwards. Recipients who are physically active after their transplant seem to do better too. Now, one good explanation of this, I think is quite interesting, is that cardiovascular disease is common for recipients. Okay, so it's one of the key aspects around mortality and morbidity after having a transplant, and we'll talk about that in a moment. But so physical activity isn't just simply good; it's not always directly good, maybe specifically for that organ. What we're seeing is among the transplant recipient population is an increased and particularly higher rate of cardiovascular disease. So given that might be the case, then physical activity helps prevent cardiovascular disease, which is the kind of mechanism in between this relationship between physical activity and it being good in terms of the biomedical outcomes. We know also that exercise programs do get recipients fitter. And we know that there's actually no specific guidelines around for organ transplants specifically, and we can think about whether that's a good thing or a bad thing. But some recipients, are encouraged to be active. Again, in terms of the fears, we need to think about these, legitimate concerns that people might have after having a transplant. So increased risk of infection, perhaps, after being on immunosuppressive drugs. Injury to the transplanted organ, scar and soft tissue pain, and also compromising other recommendations such as resting and staying hydrated. So let's quickly go through, obviously this is going to be a brief kind of outline of some of the literature. So what I'll do is I'll just kind of summarize the conclusions of some papers, but this is being recorded. So obviously if people wanted to go back and have a look at these studies, you can pause the video and have a look at them yourselves and look into them in a bit more detail. But they're essentially these bullet points that I've just gone through are the kind of the key messages that are coming through in the literature. And this is what the evidence is telling us. So this is this paper here from 2012. Talks about pre-transplant physical activity predicts all-cause mortality in kidney transplant recipients. So this was looking at physical activity at the time of transplantation, and they found that it was a strong predictor. Okay, so it was strongly associated with all-cause mortality and death with graft function later on. So the recommendation here on this paper was the kidney transplant candidates and also recipients should be encouraged to be physically active. So this is what this paper says. So moving on to after having had a transplant, this paper was about low physical activity and risk of cardiovascular and all-cause mortality in renal transplant patients. And the conclusions here from back in 2011 said that low physical activity is strongly associated with an increased cardiovascular and all-cause mortality in renal transplant recipients. So now at this point, you'll see that second sentence there, it says that intervention studies are necessary to investigate whether physical activity improves long-term survival. Because at this point, you can see both of these studies are actually associations, aren't they? So it's not an experiment. And we know that we need to be careful when we're thinking about associations and correlations versus causation. Because it might be, for example, you can think about whether if people are physically active, it's because they were generally healthier going into their transplant, not necessarily that physical activity was the thing that was making the difference. So you're a little bit unsure about that. You need to be a little bit uncertain until you have some other studies. So here's another study around correlates and outcomes of physical activity. And this was a systematic review and meta-analysis. This is done very recently, back in 2019. And one of the outcomes of this was actually what happens in systematic reviews is that they do a really big look at a whole bunch of different studies. They found 34 different studies and found out what was being looked at. And they found that actually lots of people we don't have enough sort of consistent knowledge around these particular correlates. So outcomes related to low physical activity wasn't being consistently studied enough in their views, despite growing evidence that improving physical activity might be an effective intervention in improving post-transplant outcomes. Now, with all this stuff, we need to note the language being used here. We'd love to kind of, do one of these lectures and just say that we know all the answers, and these are the definite recommendations. But look at this 2019 paper saying there's growing evidence that improving physical activity might be an effective intervention for improving post-transplant outcomes. So you'll see a lot of this in the academic scientific literature being very, very unsure. So, I mean, one of the things that we need is kind of more research and more kind of broader designs to have a little bit more confidence about the recommendations that people are making, which again is one of the reasons why those recommendations aren't as certain as they could be. So we talked about these, in some ways the science can give you these studies which look at correlates across lots of different people and see what happens over a longer period of time. Other research can look into the details, the actual mechanisms of what's going on. And one of the explanations that has been given around this is specifically looking at the types of medication that transplant recipients often take. So often tacrolimus, cyclosporin, and prednisolone, for example. The kind of theory or explanation that's going on here is that by taking this medication, which is obviously essential in order to stop your body from rejecting the transplanted organ, it actually might have some other side effects. So dyslipidemia, we can see here in an artery that the buildup of lipids within the artery itself being an issue and a potential side effect of this medication. There's also a correlation here with hypertension. Blood is not flowing easily through vessels, hyperglycemia after taking this medication, and BMI appears to be a part of the explanation as well. So this is the kind of explanation that comes up in this paper here by Biomedical et al. So we're trying to say that, so rather than looking at the correlations, these are the sorts of things that are being understood and assumed to be part of the story. So there has been some research around actually doing exercise, and this research, because we're seeing a bunch of different studies where people are putting patients on to programs, getting them to do exercise and tracking what happens. So in this particular study, we can see there's improved, as you might expect, aerobic capacity, muscle performance, quality of life. These were being improved, and importantly, no harms were observed in the short term as well, but longer term randomized controlled trials are being advocated for. So we're sort of, it doesn't seem to be causing harms, and it seems to be getting people fitter, which is a good thing. And just to kind of briefly go over these again, physical activity, there's a study going on in Italy. The Italian project is looking at people going through exercise programs as well, and improving people's daily activity through these exercise programs. What you might get, so all this basically comes into these recommendations that we give to patients. Exercise is good for you. You should do exercise. Don't do exercise if you're unwell. These kind of very basic, simple messages. And you can have a decision and think yourselves about whether having these kind of simple messages is the way forward, or whether recipients actually want more details and more understanding around what's actually going on so they can make a decision themselves. If you go onto the NHS website, you'll see different recommendations for different transplants, different organs that have been transplanted. If you have a look at the kidney recommendations there, you can see that adults are being recommended to do at least 150 minutes of exercise each week, moderate intensity exercise, and there's some suggestions there. But really what you'll see by looking at all these is they're not very different from the general population at all. And again, the jury might still be out on whether we need to have specific recommendations, or we can keep them a little bit more general and just this kind of almost common sense advice here. So you may see a physiotherapist who can advise you about exercise, for example. See slightly more detailed things around heart and lung, and as you might expect, some more guidance and support around heart and lung recipients as well. So the fears then, so I know that I'm kind of flying through these studies, but remember you can go back and listen to them. The general idea is the same, and it sticks to these kind of bullet points here. So the fears then, what are people legitimately concerned about? And are these fair concerns to be having? So increased risk of infection, trauma to the transplanted organs, scar and soft tissue pain, compromising other recommendations. So Fishman wrote a paper about this in 2007. So increasingly potent immunosuppressive agents have dramatically reduced the incidence of rejection in transplanted organs. That's fantastic, while increasing patients' susceptibility to opportunistic infections. So when engaging in sport, there may be certain things which recipients might need to be a little bit more cautious of in terms of risk management, probably very similar to how the general population is considering the risk management of around, and the government indeed is considering the risk management around spreading coronavirus infections as well. For lots of transplant recipients, the current situation is kind of a welcome to my world kind of experience, being concerned around infection sometimes. So this is a real risk, but something that people have to kind of look at and manage and understand in their own particular circumstances. So on the immune system front, we have this paper by Neil Smith and Bishop in 2017, a really extensive review of the literature there. So the concerns around infection are about kind of intense training here. So infection remains a concern in the transplant recipients, and as exercise can be detrimental to the immune system, it should be considered when athletes who are already immunosuppressed are training intensely. So it's saying there can sometimes be detriment to the immune system. Now, in this paper, I think it talks more about studies where people are cycling for 80 kilometers and then coming back and then getting some physiological testing done and seeing a kind of dampened immune system there. So I think it's a little bit different to talking about kind of everyday activity, which might be, you're talking at different extremes on exercising and doing things, but really important to be considered going forward. If you're going to engage in sports like cricket, where there's potential of being hit by a ball, then these cricketers here, who are all transplant recipients, are being creative around how to use padding and putting them on the body in certain places which are going to protect the transplanted organ. Scar management is a crucial thing that recipients need to consider, not only pain, but also the underlying soft tissue, which is actually needs to be strong after the surgery as well, is an important thing which needs to be considered. And obviously, hydration and resting are key balancing points which are important for everyone, but organ transplants recipients in particular. So I just sped that up a little bit because I really want to move on to psychological and sociological aspects of engaging in exercise. What does it mean? What does it do? What is part of the engagement in sport and exercise for a transplant recipient? On the psychological side, there's a few things that I want to raise in this public lecture. Okay, I just want to give a few ideas on what might be there in terms of the hopes psychologically. What's good about doing exercise? What are the psychological benefits? And what are the fears? Are there any things we ought to be concerned about when engaging in sport and exercise? So maybe it's about improved mood, anxiety, and confidence, sense of achievement and normality. So when you do exercise and sport, maybe the fears are relevant as well, though. So if we tell people to be physically active after their transplant, does it contribute to distress? Exercise is another thing that I have to do. And they're also a little bit more complicated are these things here, which I'm not sure whether to put into hopes and fears. They can be both of them, really. So fulfilling an obligation to one's donor, a heightened awareness of one's state of being in between healthy and ill is a concern as well. So let's expand on those a little bit. So the psychological research there's been some studies, probably not as much as we're looking at the biomedical side, but there's lots of really good research on the psychology of being a transplant recipient, but not specifically within sport and exercise. Okay, so in this paper here, this was when 26 children took part in the British Transplant Games. And what they did is they gave those children a questionnaire afterwards and asked them about their mood, their perceived health, fatigue, anxiety. And what they found in this study was that for the majority of young people, participating in the transplant games was associated with positive impact on psychological functioning in the short term. So people went to the games and ended up with kind of better state of mood, less anxiety, more confidence, these kind of things. So moving on to the research that the research that I've been leading and have with excuse me, with colleagues in University of Bath, Durham, and Leeds, we did a small study on people who have attended the Transplant Games, and found a few interesting things that we think are relevant psychologically. So this is where I'm talking around this idea of feeling in between feeling fit and healthy and having an illness. Okay, so after you've had a transplant, there is a sense of, according to the people we spoke to, there's a sense of being, feeling somewhat like you are healthy, you're feeling active when you go out and go for a run, go and do sport, you're feeling fantastic, you're feeling great. And it makes you feel like you're not ill, like you don't have an illness, okay? Especially for people who are comparing it to pre-transplant, if they're experiencing fatigue or long-term chronic illness, for example, which meant they couldn't do those sorts of things. So engaging in exercise was a way that moved them, actually created a psychological distance between illness. But in other people, actually engaging in exercise was something which made them feel, ironically closer to their illness, okay? Feeling kind of this in-between state. So am I healthy? Am I ill? What does my everyday life contribute? The experiences of physical activity I have in my everyday life, how do they position me in terms of my own self-perception of being someone who's ill or someone who's healthy? Okay, and there was also this sense of duty to look after the self, to show gratitude towards the person who was doing, who donated their organ. So physical activity was the kind of, look, I'm saying thank you, I'm being grateful for this chance of survival, the second chance of life, by making the most of it, by being healthy, being active. So in a way, it kind of fulfilled a sense of obligation for some people. And there's some quotes on the right-hand side that people can come back to and read for themselves. And there's hopefully that's something that's quite useful for people to come back to. So just the last point I'll make on the psychology again is this idea of saying that it's a good thing, saying that being active, doing exercise is good for you as a patient. So distress about transplant also relates to feelings of needing to participate in physical activity in order to avoid the negative feelings such as guilt or shame. So the key thing that is said in this paper by Segato and colleagues in 2013, it has implications for rehabilitation programs, because if you're fostering a motivation, if you're trying to motivate people to be active because it's something that's good for their health, then it may help initiate a healthy lifestyle, but it's not likely to lead to sustainable engagement over time. Okay, so essentially what they're saying here is, if we kind of say it's, if we guilt people, shame people, make them feel like this is something you need to do to stay healthy, that's not great for your kind of long-term psychological motivation. So there may be other things about people enjoying it, people finding friends, which is more important in terms of getting that long-term physical activity going. And the last thing I'll talk about then is the sociological. Now, the sociological is researched even less. So all I've got to share today is a couple of points. And it's really more kind of medical sociology or social as opposed to sociological. But what we're talking about here is things that aren't just psychological. They're about our connections, our social relationships with other people. And again, we'll look at the hopes and fears. And what I'd just like to kind of highlight in the short amount of time that we've got here today is that the formation of new social networks can provide knowledge, emotional support, and hope for the future. So if you imagine going to a sports club or engaging with something like the Transplant Games, you're forming a new social network with people. And that can actually have so many benefits for newly transplanted patients. And what do these relationships do? There's useful functions for buffering negative relational experiences of close ties. I'll expand on that in a moment. It offers opportunities to share stories and experience closeness with people. For a lot of people, having a transplant is quite a rare thing and quite rare experiences. You don't know many people in your own network currently who've had it. You can't ask your friend what it's like. So increasing these networks, increasing these relationships is hugely important, and it's really, really cherished by the people who do make these connections. Maybe we can talk about a social identity. Who are you? What tribe do you belong to in life? This is sociological at its heart. Raising awareness and policy change as well is something that people engage in when they go to things like the transplant games. Now, fears, I think there's a flip side to a lot of these things here as well. So if you meet new friends and form new social networks, could we also be sharing bad practice? Could we also be exposing recipients to mortality and grief? And could we be giving people false expectations as well? So again, just going back to the study that I led with colleagues, we can have a look at that happy picture there at the top. Everyone who was involved in this study, so the 14 people we spoke to, we interviewed about their experiences of the transplant games and what's it like? Why is it important? Why is it what was beneficial about meeting all these new people? And there were 3 different things that we picked up on. So these new friends that you meet at the games are a valued source of knowledge about illness symptoms, management strategies, and medication side effects. Also, that people got emotional support from the people they met at the games. And they also had an impact on shaping people's expectations for the future. So people would say things that we can see them on the right. So from my point of view, the games is better for me than my own family because we're not that close. I found it invaluable. I love it. I'd be lost without the games, actually. People said it's just like a little group that you can just, whenever someone is ill, you all group together. And people just get this general idea of positivity from the games. Okay, so it's good to see that thousands of other people are going through the same thing and successfully. It's probably the main thing. It gives you hope and you can keep going, keep living for as long as possible. So there's lots of these kind of things that people gain from their social connections by going to things like transplant games. I think it's also important to think about the role of when you're publicly displaying how you're exercising, which is for many people is the epitome of sort of being healthy, isn't it? For many people, this is something demonstrating how successful organ transplantation is. In a way, that is a way of spreading the message, spreading the word about organ donation as well. So there's an impact. Then there's a kind of social effect, social conversation that people are contributing to simply by doing these things and doing it in public. And hopefully the idea is that that has some impact on anyone who knows about it, anyone who learns about it. But the study that I'm really excited about, that hopefully some publications will be coming out over the next short period of time, is the PhD by Carl Beskerby at the University of Bath, who I've had the pleasure of supervising over the last few years. What Carl did is he really, really went in depth and in the most kind of rigorous, thorough study that is going to be around on this topic, I'd imagine. On these social networks. Okay, so these social networks, what he did is he recruited people who've been to the games for the first time and asked, do these people have an impact on your ability to self-manage your condition? So what we're looking at here is one example of a depiction, an illustration, a visualization of all the friends and family, all the people that are in your social network that have an impact on your self-management. So if you say to someone, who helps you manage your illness? And you think, well, so-and-so takes me to the doctors, so-and-so puts an arm around me if I'm feeling upset, so-and-so gives me advice. And you can kind of see this network of friends and family that have some impact on self-management. And what was really interesting, even though it was very different for lots of different people and there was no clear pattern, what we saw was that in this particular network, look at all the people here that were from the transplant games. That after going to the games, these people stayed within their network, their perceived network of people that actually helped them self-manage their illness. And what's really interesting here is that, you know, for some people, they became quite close. That's not always the case for everyone. But if you have a look at so close means kind of in the center of the visualization there. But if you have a look at the far left, there's some people who are kind of out on the periphery. This is what Carl calls loose ties or weak ties. So even though they're not particularly close and they don't have huge connections or interactions with them daily, they were still important for their self-management. And that was because people actually, they didn't want to talk to their spouses and their close friends sometimes. They didn't want to make them feel worried. So the recipients themselves were worried about causing anxiety among their close ties. So Carl calls this the close tie anxieties. So we can see this sort of thing is certainly significant in terms of the social aspect of engaging in sport and exercise. Okay. And you can see a quick quote there. So weaker ties did not impact on the types of networks participants had. They provided useful functions for buffering negative relational experiences of close ties and offered opportunities to share stories and experience closeness, which promoted a sense of longevity. Okay, so really, really interesting study, which hopefully will be coming out soon. So overall, that's my overview then. So we've got biomedical, psychological, and sociological things going on here. And there are hopes, which are possible benefits of engaging in sport and exercise, but we also have fears, concerns, and possible harms. And without saying too much, we do need to be cautious here. And we do need to always take fears and concerns very seriously. But it doesn't seem to be. It seems to me the literature and what people are saying is that physical activity should be promoted, and overwhelmingly the hopes are and benefits are really important to take on board. Okay, so my last point that I want to just say as I finish in the last couple of minutes here is how can we make the future even brighter? So imagine now people who are currently ill or waiting for a transplant, and the next however many months or years, we will see lots of new transplanted patients, new recipients out in the world. How can we make their lives and their engagement with sport and physical activity and exercise even better? So I would push people towards the campaigns that are out there. I think campaigns and initiatives are fantastic, and we probably need more of them, and we need to develop them a little bit more because they really are in their infancy. As we know, we've got the medical aspect of transplantation is so important, but the shift towards kind of long-term health is quite a recent thing that people are trying to improve. So people should certainly have a look at the Refit for Life program, which the World Transplant Games Federation is promoting. And so recipients can start the program, and they want to try and get more transplant recipients more active more often. A fantastic resource from Canada as well, the Can Restore website, where you can see lots of opportunities to kind of network, video resources, and a whole bunch of things like that. Now, remembering the importance of making connections and sharing stories and listening to other people's experiences, the healthtalk.org website is a fantastic resource, a bank of people who've had a transplant, well, of all illnesses, but you can search for transplantation, people just explaining what their everyday life is, what they can do now that they couldn't do before, just talking in a non-patronizing way about what their everyday life is like. And that's probably a useful resource for lots of people. I really like things like what's happening in the Oxford Young Adult Clinic. This is for young adult kidney patients, many of whom will be either waiting for a transplant or have had a transplant. Now, going through a transplant is difficult for everyone, but in particular, this clinic is focused on what's it like to be a young adult who's had a transplant. And instead of going to a clinic every month and kind of just sitting in the waiting room, seeing a doctor and leaving, in this clinic, there's a youth worker daily in this situation. Does a fantastic job of having a clinic actually outside of the hospital setting, okay, and a kind of a youth club feel, which does involve some sort of sport and some games and exercise, but really the focus is on getting people networking and meeting each other and talking about what they're going through. I think that's a hugely important thing. I think sport helps facilitate that, but it can be done without sport as well. And we'll end on the current campaign, which has just recently been rolled out on Leave Them Certain. So all we're talking about in terms of physical activity and exercise is massively important. The other thing we all need to be aware of and spread the message as much as we can is remembering that organ donation is important. So let's just finish on this video.
I remember Dad's dance moves and how he was always cracking jokes. I'll never forget his killer tash. Family was his world. Dad was just a really happy character. It's his smile I remember most. But I also remember when they asked if he wanted to be an organ donor. And I just didn't know.
Okay, so thank you very much for listening. I hope we've still got a few people on the line and we will be taking questions. So thank you so much. Feel free to drop me an email and have a look and get in contact on Twitter if people would like to. And we've still got a little bit more time now to take some questions.